Like in the European or Malaysia or America, a Chinese physician, they do the traditional acupuncture is do the needle on the acupuncture traditional Chinese Mandarin pie. Then the physiotherapy, they do the needle on the trigger point. Some of them will put the electronic stimulate with the needle. Then my treatment is that I do combine with the trigger point and the traditional Mandarin pie combine together. Then I use the traditional Chinese needle treatment way for the teaching and stimulate the trigger point. Then will be more painful a little bit, but will more effective. I use the acupuncture, the needle, but use the trigger point and French air point, Yamamoto sky acupuncture, and combine with the Mandarin pie were more effective. Then use from the different country people use different treatment. From my experience, expect the Chinese patient, others people, just country people were all more scared by the needle pain, needle fading, then and more expect from the Chinese patient. So, like maybe the European people, I do the acupuncture for one point, they will feel the Chinese Mandarin point, the line for the energy. The line is over there, but if I do the trigger point for the dry needling, just there, they just feel like stuck the energy there, just stuck the feeling there. Then so for the traditional Chinese Mandarin pie for the European were more effective. Then if the Chinese patient already like the resistance of the needle feeding, so they have to use the more different point to sensitize their body. So I combine the French air point and Chinese air point and Chinese traditional Chinese Mandarin pie and the trigger point, similar pie and the Yamamoto style acupuncture point. Combined with the different medical treatment will more effect for the Chinese patient, because I also figure out that if you use different treatment is more effect for the different country people. Like you can use the Japan Yamamoto scar acupuncture expect for the Japan patient, like for the maybe Malaysian, Thailand, Korean, European were more effective, but for the Japanese have to use the traditional Mandarin or the trigger point were more effective, because the different country people, their people have the different resistance for the needle feeding. So the good medical care is that you have to combine with different race medical, different country medical, then choose the most suitable for the patient, for the different personal physical.